As we all know, keratoconus and other corneal dystrophies have a genetic, patients have potentially have genetic predilection for those conditions, and we were really left with no option of discovering if there was a genetic background for a patient who may have appeared to be at risk with our ancillary diagnostic test for keratoconus and other dystrophies. My background is in cornea, and I have really kind of specialized in corneal transplantation. I also, even prior to that, had a background in microbiology and genetic and molecular genetics. And so for me, this was quite intriguing to have a genetic test to really give us a sense of whether or not the patient has any genetic background that would put them at risk for corneal dystrophies. I would say we all see patients in our clinic where they have maybe an inkling of findings that would concern us about form-fruit keratoconus, but nothing really definitive. And genetic testing is simply another complement to the testing we do. It can validate your concerns or your suspicions, or it could potentially negate it. As we know, genetic testing that's available now through AvaGen, that's done in the office, gives you kind of a high-risk range to low-risk range. And I have found that when a patient's test result comes back at one end or the other end of the spectrum, it really kind of helps my diagnostics of that patient and my counseling of the patient of whether or not they're at risk for keratoconus, if their findings on tests were actually indicative of keratoconus or other dystrophies, or whether or not they should consider having refractive procedure. This would be in a patient, for example, in our practice when they come in for refractive consultation. If they have inferior steepening on the corneal topography, thinner cornea, I've had patients who come in with a shift in their refraction, especially increased cylinder. I had a patient who gave a distant family history of keratoconus and had real concerns about whether or not she should have LASIK done. We all, refractive surgeons, we all have our sensitive points of findings on our exam, and there's always clues that, again, raise our suspicion, but we don't necessarily have a definitive test to help us detect predilection, genetic predilection. And the AvaGen test is, again, an added complement to the other testing we do and can help either validate your concerns or potentially negate it. If it's a low-risk test, it can give you some confidence to forge ahead. I think it's about time. I think absolutely we know and understand that there's, again, genetic background or genetically, how should I say it? There are conditions in ophthalmology such as corneal dystrophies, macular degeneration, and others that have a genetic connection. And so if we can use genetic testing as a way to, again, help give us confidence as clinicians, as diagnosticians, in making that assessment and counseling our patients appropriately, the more opportunities to really offer the best care possible, the better. I think it's such an easy test to do. It is most definitely one that patients appreciate having in your practice. It has really elevated the level of premium care that we offer our patients by giving them the option of having genetic testing if there's any concern, again, around conditions that would put them potentially at risk for or extra added risk with refractive surgery. And it's just, again, it feels great as a physician and a surgeon to be cutting edge and at the forefront of the science.